An FDA advisory panel breaks with the White House and says no to mass Pfizer vaccine booster shots for everyone 16 and older. Good evening and thank you for joining us. I'm Carlo Cicchetto.
And I'm Marcella Lee. That same panel says yes, though, to authorizing booster shots for people 65 years and older, as well as for those at higher risk of severe COVID-19 complications. This would be 6 months after full vaccination. There are a lot of moving parts to this story. News 8's Kirsten Holmes just spoke with one of the doctors on this panel about his vote. Kirsten?
Hey guys, that vote actually failed 16-2, and I spoke to a doctor, one of the two doctors who voted yes to giving booster shots to the general public. Now we are here in Kearney Mesa where businesses have been struggling to make it through the pandemic. That booster shot, they said, they thought the vaccines were supposed to help everyone get out of the pandemic, but today's announcement led to a lot of confusion.
This vote did not pass since the majority voted no.
And that was the Vaccination Advisory Panel's vote on whether everyone over the age of 16 should get a COVID-19 booster shot 6 months after vaccination. Dr. Archana Chatterjee, Dean of the Chicago Medical School at Rosalind Franklin University, notes,
I have major concerns with regard to the extrapolation of data from much older populations to 16 and 17-year-olds. We have no data.
Mark Sawyer, pediatric infectious disease expert at Rady Children's, voted in favor of allowing booster shots to the general public because he says,
in the United States, something around 1 million people have already gotten a booster dose. And so far, we're not hearing about a rise in side effects that would be too concerning. We also saw data from Israel, which has been giving booster doses for 3 months now.
The decision comes as a blow to the White House as the Biden administration previously announced a plan to start administering booster shots to the general public as soon as the week of September 20th. So did the White House get ahead of the science?
Yes, I think they went a little bit out of line, out of turn.
While we wait for more data to support booster shots to the general public, Argentina Servin, assistant professor at UCSD, says getting vaccinated is still the way to go.
The deaths and hospitalizations that we're seeing are among people that haven't gotten the vaccine. Not only are we less likely to be hospitalized due to COVID, but if we do have symptoms, we are more likely to have very mild symptoms.
If we just got people who so far have not gotten immunized, if we could get them immunized, that's going to have a much bigger impact than booster doses.
Okay, I'm going to walk you through the process because it was kind of confusing. Today's vote came from an FDA advisory panel. Next up, the full FDA will give their recommendation. Next week, the CDC will vote on giving booster shots to the general public. But all health officials say that we should all wait for a full recommendation before all of the general public gets those booster shots. Back to you.
Kirsten, the FDA did make a recommendation on who should be getting booster shots, though. So there are still some members of the population that should be getting them.
Absolutely. Those who are immunocompromised or who already have pre-existing conditions, of course, talk to your doctor first, but booster shots have already been approved for people in that population.
And 65 and older, an FDA recommendation as well. Thanks so much, Kirsten.